welcome to our show, Health and Wellness, Myths and Facts. Endocrine glands produce and secrete hormones that are responsible for many important body functions. It plays a vital role in whether or not you develop diabetes, thyroid disease, growth disorders, sexual dysfunction, as well as a host of other hormone-related disorders. How often do you consider the health of your adrenals when you consider the state of your health? The sad fact is that adrenal health is largely overlooked, and the role of the adrenal glands in your body is to release certain hormones directly into the bloodstream. Many of these hormones have to do with how the body responds to stress, and some are vital to existence. Adrenal health may not be at the top of your priority list when it comes to looking after your body, but if you do not take care of your adrenal glands, you may suffer from various conditions associated with it. We have an expert panel with us. Our experts will provide medically accurate and actionable advice to help prevent the development of adrenal disorders, as well as guide our viewers with effective long-term management strategies. So let's welcome our guests today. We have Dr. Ganapathi Bantwal, endocrinologist of St. John's Medical College Hospital in Bengaluru. We also have Dr. Dominic, consultant endocrinologist, Aster MedCity from Kochi, as well as Dr. Mukhopadhyay, endocrinologist from Health World Hospitals, Durgapur. A very good afternoon, doctors, and welcome to NDTV. Let me start my first question with Dr. Ganapathi Bantwal. I'd like to start with you and ask you, hormonal imbalance in adrenal glands can cause adrenal disorders. Is it possible to prevent adrenal disorders, and what are the reasons for the dysfunction of the adrenal gland?
Thank you. That's a very important question. So let me begin with what's an adrenal gland. It's also known as the suprarenal gland. It's situated above the kidneys. So it produces hormones like glucocorticoids or cortisol. We call it as the stress hormone, which is required for the fight and flight reaction. Then you have what are known as mineralocorticoid, which help in regulating the salt and water regulation of that. And then you have adrenal androgens, which play a role in the puberty also, a little bit about puberty. So when you have an excess of these hormones, it can produce what is known as Cushing syndrome. If there is an excess of mineralocorticoid, it produces what is known as hyperaldosteronism, which is characterized by high blood pressure with a low potassium. And then you can have a cancerous growth of this, which is called as an adrenocortical carcinoma, where it could produce all the hormones in excess. It can also be because of hypofunctioning, that is, the hormones are produced in low quantities. Say you have what is known as Addison's disease, and the most commonest cause being autoimmune, but in India, it continues to be infective, like what is known as tuberculosis or other infective cause. The other main reason why this happens is because of exogenous steroid abuse, which suppresses our own gland. And when suddenly you stop it, the patient lands up in what is known as adrenal suppression. He has symptoms of hypertension, etc. So a little bit difficult with health to say we can prevent this. Maybe the infective causes that could actually come down when you're healthy. You have a healthy diet, you do good exercise.
Right, doctor, thank you so much for breaking that down for us. Now, how widespread are these adrenal gland problems among Indians? Does their prevalence differ when it comes to, say, men or women? Dr. Dominic, if you would like to answer that question.
Yeah, good afternoon. Adrenal disorders are actually rare. They say about, we don't have much evidence from India. From overall the world, if you look at the numbers, we can see that about 1 person in 1 lakh, roughly 10 persons in 100 persons in 1 million, or to that extent that adrenal disorders are seen. If you look at the adrenal deficiencies, why it's happened, we already dealt with the tuberculosis and the stuff like that. We know most of the autoimmune conditions are commoner in females. So again, that is true for adrenal insufficiency. We see more of females in our patient population than the males. So it is pretty rare. You need to have that. All the doctors who take care of patients have to have that suspicion in our minds whether we are dealing with an adrenal insufficiency, because it is a life-threatening condition, but it is treatable. Some of the most common symptoms, again, lethargy, confusions. You can have severe tiredness, weight loss. People can land up in hypoglycemia, low sugar, low BP, and finally become unconscious.
Right. My next question is for Dr. Mukhopadhyay. Doctor, can various autoimmune diseases cause adrenal dysfunction? If yes, then what are those conditions that one needs to watch out for?
Good afternoon, everybody. Right. Autoimmune disease, as Dr. Ganapathi has said, is one of the cause or important cause for adrenal dysfunction. But various autoimmune disease, like for example, thyroid has autoimmune disease which can cause hypothyroidism or hyperthyroidism. So other autoimmune disease may not affect the adrenal gland directly. Though adrenal gland dysfunction is caused by autoimmune disease, and in our country, probably the commonest cause is tuberculosis. So yes, autoimmune disease is a cause of adrenal deficiency, but there is no particular autoimmune disease which can cause adrenal insufficiency as such. So it is a bit convoluted way I am telling, but this is what is the problem of the adrenal glands, is that it is affected by autoimmune disease. However, there is no autoimmune disease which directly affect the adrenal gland. For example, systemic lupus erythematosus or SLE is an important autoimmune disease. However, it usually do not affect the adrenal gland directly. But as Dr. Ganapathi has said that, because this disease need to be treated with steroids, so we give steroids from outside, and this steroid then causes adrenal gland dysfunction or suppression. So in these patients, they should not stop the steroid suddenly, because that can lead to the adrenal deficiencies, which my previous colleague has just said. So this is an important advice for those who are being treated for all type of autoimmune disease, that they should not stop their steroids without consulting their doctor or the primary care physician.
Right. My next question is for Dr. Bantwal. Dr. Dominic just mentioned feeling tired. What is adrenal fatigue and what causes it, Dr. Bantwal?
Actually, it is a non-existent clinical scenario. It's based on the concept of downregulation of the adrenal gland because of chronic stress, which could be physical or pathological stress. But the problem, it does not have any physiological basis. It's been developed, it's quite common in the West, where the naturopaths, they tell that, oh, you have adrenal fatigue, let me treat you with that. But actually, there's no clinical entity. Many times what happens, if you have these symptoms like fatigue, tiredness, they say, oh, it's because of that. But actually, there's no entity. So many times they give what is known as adrenal supplements. And when they looked into that, it predominantly contained T3, or sometimes it contained budesonide. In the clinical scenario, like you have what is known as post-traumatic stress disorder. So sometimes, say you have a death of an infant, so there's a severe stress, or HIV/AIDS. So in these scenarios, people tried using these type of drugs, but actually they are of not much use, because when they did the actual stimulation of the adrenal gland, they found it was all intact. So basically, adrenal fatigue is, strictly speaking, a non-existing entity developed by the so-called naturopaths, quote unquote.
Right. Dr. Nibu, Dominic, get us a sense of what happens when a body goes into an adrenal crisis. How does one manage a patient who is probably going through that sort of crisis?
Yeah, actually, that's a very important thing to know. The adrenal insufficiency is incompatible with life, to put it in a straightforward way. If somebody who is having very less cortisol, which is the adrenal hormone, that is important for body's day-to-day function. So if that is found to be severely deficient, the patient can die. That happens sometimes very slowly, but sometimes it can happen all of a sudden without much symptoms before. The most common symptoms that patients say are like diarrhea, vomiting, inability to gain weight, or rather losing weight, They feel like having severe tiredness, lethargy, not able to do common routine activities, and they may be suffering from low BP, low blood pressure, low sugar in the body, and finally they land up with confusion and clouding of consciousness. So this is where a scenario where you are suspecting the adrenal insufficiency. Hyponatremia, the low sodium in the blood, is another one of the most common scenarios that we encounter in hospitals, where we suspect that the patient might be suffering from adrenal insufficiency. The treatment is very simple. You start steroids. Steroids are the mainstay because the cortisol is nature's own steroid. We have the synthetic steroids with us. But in addition to that, we have to correct the volume. The blood volume might have gone down. You have to replace with fluids and other supporting measures. Most often this happens, the adrenal crisis happens when there is an infection going on. So probably you have to treat that with an antibiotic as well.
Right. My next question is for Dr. Ganapathi Bantwal. Can you explain a bit about steroid-induced adrenal problems?
Yeah. So when you start taking steroids, it suppresses our own gland. So exogenous steroids suppresses our own adrenal gland. We call it because of a negative feedback mechanism. And as a result of which, this is the most common cause of adrenal gland insufficiency. So we call it as a type of tertiary adrenal gland insufficiency. So here what happens is, because our own glands are not functioning because of the exogenous use, and if you stop this drug suddenly, so they get all the symptoms of adrenal insufficiency, which has been highlighted by the previous speaker. So then what do you do in them? So you have to actually restart the steroids and gradually down titrate the dosage. So it may sometimes take 3 to 6 months for recovery, and in rare instances, it may take even an year or two for them to recover from the function of our own adrenal gland to function. So this is a very important scenario. So that's the reason somebody is on chronic steroid abuse. We say chronic, say you are using prednisolone, etc. For more than, say, 3 weeks, our gland gets suppressed. So this is a very important thing. You should not stop suddenly. If you stop, you get these symptoms of adrenal insufficiency, which has already been highlighted.
Right. Dr. Mukhopadhyay, I would like to find out, can adrenal fatigue cause autoimmune diseases?
Well, Dr. Ganapathi has already said that there is no medical term as adrenal fatigue. The nearest term would be adrenal insufficiency, where for either exogenous cause, that is steroid given from outside, or endogenous cause, that is either tuberculosis or autoimmune disease, patients don't produce adequate amount of their own steroid. So, so this is what it is, that adrenal fatigue is not existent. However, we should not just, the doctor should not just ignore it, saying that it is adrenal fatigue, because we need to go to the bottom of it. Because what the patient is coming to us is that they are feeling tired, depressed, etc., which are very common, especially if they are exhausted. Even other diseases can cause this, like hypothyroidism, that is thyroid dysfunction, low thyroid gland function. Then even very high blood sugar or very low blood sugar, both of them can cause tiredness, fatigue, etc., as well as if there is, because of the adrenal steroid deficiency, there is low blood sugar. So our approach, that is the doctor's approach for these patients, should be that you should give a sympathetic ear to their symptoms, get to the bottom of the disease if possible. If there is none of the causes can be found, then you can tell the patient that nothing to worry. There is nothing you are suffering from, means there is nothing to worry about this adrenal fatigue, which is common currently in the in YouTube, etc. People are telling about this. So do not listen to them. And we have got your disease, or you don't have a disease, or I have got a disease for you, and this is the treatment. So that's how our approach to this adrenal fatigue, which is common in the society.
Right. Thank you so much, Doctor, for breaking it down for us. With that, we're slipping into a very short break on our show, Health and Wellness, Myths and Facts. See you on the other side with a whole lot of questions that'll be answered by our expert doctors. Hello and welcome back to our show, Health and Wellness, Myths and Facts. We have with us Dr. Bantwal as well as Dr. Dominic and Dr. Mukhopadhyay also joining us on the show. My next question is for Dr. Dominic. What is congenital adrenal hyperplasia and how common is it?
Congenital adrenal hyperplasia is a condition where the adrenal gland is not producing the hormones in a proper way. So this is mostly manifested in the early childhood itself after the baby is born. And you look at it as to the baby can suffer from ambiguous genitalia, which means that the genitalia can neither be determined as male or a female. The child cannot be determined as a male or a female. There is confusion regarding that. And then the baby can have dehydration and difficulty in gaining weight, and babies can die. So that's a life-threatening condition again, because the important hormones are not produced in the manner which need to be. So most commonly, it happens in to the tune of say around 1 in 10,000 to 1 in 20,000 of births. So it is common, and that is why we advocate that there should be a screening which is happening during the time of birth, as like the hypothyroidism and all. So this is congenital adrenal hyperplasia. The treatment again, because the pathways of production of this hormone is blocked, or it is not happening because of deficiencies of the enzymes producing those, which is again congenital, which is hereditary. It is there in the genes. So you cannot change that you can only treat that with the steroids. You replenish whatever hormone is deficient, and the baby will become all right. And the problems with the genitalia, if at all it has happened already, you can correct it through surgeries if required at a later stage, or sometimes even earlier enough.
Right. My next question is for Dr. Mukhopadhyay. What does adrenal gland suppression really mean?
Adrenal gland produces 3 hormones. One is called cortisol, which most of the patients are aware, that is also called in colloquial terms as steroid. Then sex steroids, which in males is not very significant, but in females these are significant. And lastly, adrenaline, that is from where the adrenal gland name came. Adrenaline is a hormone which is required for fight and flight response of any organism. So whenever we are frightened or whatever, this hormone needed to get us going. So there are 3 steps, that is the 3 hormones. So mostly the adrenal gland suppression, which the doctors are more concerned about, is the steroids, because many patients, willfully or unwillfully, they take steroids, may be prescribed by any naturopath or any other non-medical doctors who may not be aware of the dosage of those steroids. And when they take it for prolonged duration, the adrenal cortex, that is the outer lining of the adrenal gland, gets absolutely shrunken. And that leads to absolutely no steroid production. And suddenly, if the patient decides to stop this, they get into severe adrenal crisis, which means they can even die. They cannot keep their pressure going. This is a medical emergency. And as Dr. Dominic has said just now about congenital adrenal disorders, these patients also do not produce sufficient steroids. And these congenital adrenal deficiencies are not very straightforward. That is, it is not in black and white. It can be many shades of gray. So there are few people who may not know that they have got this type of disease, and suddenly, because of some external stress, they started feeling the deficiency. So So this is actually, in short, which we can say what is called as adrenal gland suppression.
Right. Thank you so much, Doctor, for breaking it down for us. My next question is for Dr. Bantwal. Is it possible to improve adrenal function naturally with specific lifestyle modifications, whether it's diet or exercise?
As you know, exercise improves your cardiovascular fitness, and it also helps to improve your immune system. Now, as a result of this, the infective causes of adrenal gland insufficiency because of, say, tuberculosis, histoplasmosis, can actually be reduced by good diet and exercise, because these diseases happen when your immune system is down, because you're weak, you're not eating properly, you're not healthy, so that's the time. And also, there are certain manifestations of excess cortisol secretion, like difficulty in getting up from the squatting position, stretch marks, purplish color stretch marks. These are features of excess cortisol secretion that actually may get ready. So this happens mainly in patients with, say, who are athletes. And also you have what is known as restorative yogas. People have tried that once again, where you do deep breathing, you focus on your breath. And this is also supposed to help to improve or boost your immune system. And I would say the infective causes of, say, the adrenal insufficiency because of tuberculosis, etc., may actually improve because of this. So as you know, it helps to focus on your breath while releasing tension. So these types of ones improve the immune system, and diseases which are more likely because of reduced immune functions actually improve.
Right. So adopting healthy habits can reduce the strain. Yoga, of course, one of those solutions. My next question is for Dr. Dominic. Can adrenal gland problems cause shortness of breath in a patient?
Normally, we would say the breathlessness is not the shortness of breath is not a symptom of adrenal gland insufficiency. But indirectly, it can produce in the way by which it can produce like if the patient has got anemia, or if the patient has got low blood pressure, then because of adrenal insufficiency, those are some of the situations where you can produce breathlessness. Adrenal insufficiency patients can again have some sort of muscle weakness, general tiredness, lethargy, which again can sometimes be counted as shortness of breath. Usually, and again, for patients with excess of cortisol in their system, like Cushing's syndrome, they can have, because of the weight gain and muscle weakness, they can also again complain of shortness of breath. But per se, shortness of breath is not a classical symptom of adrenal insufficiency, but they are the weakness, tiredness, nausea, vomiting, hypoglycemia, hypertension, etc.
Right. Thank you so much, Dr. Dominic, Dr. Bantwal, as well as Dr. Mukhopadhyay for joining us on the show Health and Wellness Myths and Facts here on NDTV.